Okay, I'm outside the door. I'm going to verify provider's orders, verify care plan. I'm going to maintain standard precautions. Knock, knock. May I come in? Hello. I'm going to provide patient privacy, and I'm going to close the curtain and the door, and then I'm going to hand hygiene. Hello, my name's Maribel. I'm a student nurse at Nevada State College. Nice to meet you. Can you please verify with your name and date of birth? Okay. Jeffrey Rourke, 4/30/1980. Perfect. Mr. Rourke, do you have any allergies? No? Okay, perfect. May I have a seat? Okay. So, Mr. Rourke, today what we're going to be doing is I'm going to be cleaning your tracheostomy, and I'm going to remove the gauze and clean it out, clean up your inner cannula. I'm going to assess your vital signs and go ahead and clean the outside of the tracheostomy and make sure that everything gets clean and you're comfortable the whole way. Okay, is that okay with you? Okay, if you have any questions along the way, feel free to ask me, and let's get started, okay? Is that okay? Okay, so I'm gonna go ahead and make sure that Mr. Rourke is in a semi-Fowler's position. Once I see that he's in a semi-Fowler's position, I'm going to go ahead and connect him to the, make sure you can see that. Okay, I'm gonna go ahead and connect him to the oxygen, and I'm gonna assess his vital signs before and after. I'm gonna connect him to the oxygen, assess his heart rate, his respiratory rate, and his blood pressure. Okay, and so once I do that, I'm going to go ahead and set the suction regulator to 80 to 120. And then I'm going to go ahead and ventilate my patient with 100% oxygenated bag valve mask as needed, 2 to 3 pumps at the speed of a regular breath. Okay. Now I'm going to go ahead and open this. This is a very sterile technique, so I'm going to go ahead and be careful when I open up my gloves and make sure that I maintain a sterile procedure. Okay. Make sure I put my gloves on correctly. Okay, let me put that on. Maintaining sterile technique. Perfect. Okay, and then I'm going to go ahead and grab these cuffed. Okay, and then I'm going to go ahead and make sure I don't touch anything so then I can go ahead and fix them. Okay, right here. Make sure I can fix my gloves right here, just like that. Okay. So now that my gloves are on, they're sterile, go ahead and grab my catheter, my suctioning catheter. Make sure I maintain a sterile technique. And I'm going to go ahead and connect this to the suction regulator. And I'm going to go ahead and put about 12 to 13 centimeters in. I'm going to go ahead and on the withdrawal, I'm going to go ahead and intermittently suction the, on the way out, I'm going to go ahead and intermittently suction. And then I'm going to go ahead and make sure that it doesn't take more than 10 to 15 seconds on the way out. Then I'm going to go ahead and put that there. And then I'm going to go ahead and grab my gauze, and I'm going to go ahead and take my gloves off. Okay, I'm going to go ahead and dispose of it. And now I'm going to go ahead and perform my hand hygiene, and then I'm going to make sure that the skin of the integrity, I'm going to assess it, perform my hand hygiene, and go ahead and clean this up, dispose of that. And then I'm going to go ahead and open up my basic tracheostomy care kit, and go ahead and open it up. Okay, so now that I've opened it up, I'm going to go ahead and put my saline, these right here. I'm going to put about 1 to 2 inches of saline in here. And I'm not gonna close it. I would not close it, okay? Just go ahead and put it to the side, and then I'm gonna go ahead and open my gloves. Sterile technique as well. Okay, go ahead and put them on. Make sure I maintain a sterile technique throughout the whole thing. Go ahead and cuff them, and then I'm gonna go ahead and make sure they're good, okay? So now the next thing I'm going to do is with my left hand, I'm gonna go ahead and grab just the tip of the inner cannula, and I'm gonna go ahead and put it in here. And then I'm going to grab, this is my sterile hand, and I'm gonna go ahead and clean the outside and the inside with the secretions, okay? And then I'm gonna go ahead and dispose of that. And then I'm gonna go ahead and rinse it off. Okay, rinse it off, okay? Make sure you don't contaminate it or anything like that. And then it maintains sterile, and then I'm gonna go ahead and put it in there, okay? And make sure it's dry when you put it in there and everything, okay? And then the next thing that I'm gonna do is I'm gonna go ahead and grab a gauze. I'm gonna grab a gauze. I'm gonna get some saline, and I'm gonna go ahead and clean it, the outer tracheostomy, and then I'm gonna dispose of that. And then I'm gonna go ahead and grab one of my Q-tips, okay? Make sure you maintain sterile technique, and I'm gonna go ahead and clean it. I'm gonna do about 2 to 4 inch margin around. Throw this away, and then I'm gonna make sure I grab this, and then another 2 to 4 inch margin, okay? I'm gonna throw it away, and then I'm gonna make sure I pat it dry, make sure it's pat dry, and then I'm gonna go ahead and put my gauze on there. Okay, now that my gauze is there, I'm gonna go ahead and secure it. So I don't have assistance, so what I'm gonna do is I'm gonna go ahead and leave the old tracheostomy tube holder in place until the new device is secure. So I'm gonna align the strap, and I'm gonna make sure, so we have it right there. I'm gonna align the strap under the patient's neck, so the Velcro attachments should be positioned on either side of the trach tube. Place the narrow end of the tube under through the eyelids and then on the faceplate, and secure the Velcro closures. And does that feel okay? Make sure you communicate with your patient, okay? And then I'm gonna verify that the neck strap is about 2 fingers snugly, okay? Position, make sure my patient is comfortable, okay? Okay, so now that I've done all that, I'm gonna go ahead and grab my normal saline, and I'm gonna label it, and I'm gonna close it, okay? And then I'm gonna go ahead and dispose of all my stuff, take my PPE off, and then I will hand the patient, Mr. Ward, here's the call light, and I'll be back in about 30 minutes to check on you. If you need me within then, go ahead and hit the call light, okay? And then I will check on him in 30 minutes. I will provide patient private, I will perform hand hygiene and throw away all my stuff.